mental disorders such as depression, bipolar disorder, and schizophrenia are noted risk factors for suicide. Currently, major depression, which is a type of mental disorder, is known as the leading cause of disability worldwide, according to WHO. More on the statistics, mental illness have been found to increase the risk of drug use and alcohol addiction. One may ask, what is mental illness or what is mental health at all? Mental disorder is a disease of the mind that is characterized by marked behavioral and emotional problems, severe enough to interfere with the individual's occupation, social, or other areas of their function. Mental disorders are very treatable. There are effective treatment for mental illness, and the treatment modalities can be by use of medications or by use of what we call psychotherapy, specialized therapies that are rendered by trained clinical psychologists. And so no need for anyone to live or suffer from untreated mental disorders. The number one risk factor for mental disorders is usually stress. Stress has been found to be the number one risk factor, and that is why we always advise people to take rest whenever they feel stressed out. There are several other factors that serve as risk factor for mental disorders, like using of substances of abuse, excessive use of alcohol, use of drug abuse, have all been found to be a risk factor for mental illness. But the primary one is stress, and the stress can be from trauma one suffered in their lifetime. The stress can come from financial difficulties. The stress can come from relationships, etc. So mental disorders come in varying forms. Most of the time, all we know is that somebody has mental disorder, and the picture that comes to mind is that person eating from the refuse dump, that woman walking around naked, that person carrying a lot of dirty things in a polythene bag on their back, or that person who is aggressive and fighting everybody. Those people are just a minority of all the mental disorders that we have. There are several others who are well dressed, but they may be going through mental illness. They are doctors, some are lawyers, some are teachers, some are the VIP drivers who drive us to Accra, Kumasi, Tamale, up and down. Some are the market women we buy things from. Some are with us on this platform. So it is not everyone that is having mental illness that you would obviously see that they are not dressing well or they are aggressive or things like that. Of course, those who become aggressive and those who do not dress well and they are walking around naked are also going through a mental disorder. But like I said, they form just a small minority that we call the psychosis. Those may be suffering from schizophrenia, but there are others who suffer from mood disorders. They are always sad for no apparent reason. Those are the ones that usually will attempt suicide. They have everything in this world to make them comfortable, and yet they feel that they have failed in life. Those are the mood disorders. Examples are depression. Some people would also suffer from anxiety disorder. They are always on the edge. They feel that something bad is about to happen. They are always anxious. They cannot sleep well, etc. Those are the mood disorders. And we have others like substance abuse. They are addicted to, they can be addicted to anything. It can be just diazepam or sleeping tablets. If you don't take it, you can't sleep. It's not only the hard drugs. So people are addicted to things like gambling. People are addicted to marijuana, to alcohol, and things like that. All these categories of diseases fall under the broad umbrella called mental illness. And like I said, there are treatments, very good treatment modalities for each one of them. So in conclusion, I would say that in order to prevent mental disorders and live in good mental health, not just to prevent depression, but to prevent all mental disorders. It is good that we are honest with ourselves when we see changes in us, when we see changes in our mood, and it is becoming more consistent, or it is lasting longer than usual. When we realize that we are not sleeping well, when we realize that we are now easily angry, easily irritable, these are all signs that there may be something going on with our mental health. Let us seek expert advice. Let us get to see a psychiatrist or a psychologist who will assess us, and then in order to prevent some of these illnesses, mental disorders, let us try to make sure we rest well. Sometimes we look for money, we don't even get time to enjoy some of this money. How many of us are able to take leave? Sometimes when we are on leave, that is the time we are using that time to catch up on other businesses, other personal businesses. Please, let us try to rest, and then let us cultivate the habit of pampering ourselves. Don't wait till it's your birthday or Valentine's Day for someone to take you out. Learn to pamper yourself. Get a pedicure, a manicure. Go and sit somewhere and eat buffet breakfast or buffet lunch. And then apply effective time management. If you're able to apply good time management, that is when you are able to catch rest in between. And then avoid setting unreasonable targets for yourself. Don't compare yourself with other people. He or she has finished building. She or he is married and has bought a car. I must also get the same level. Please be in your lane and move at your own pace so that you don't bring unreasonable stress onto yourself. And as a Christian myself, one thing that helps to send or keep mental illness away is to live with an attitude of gratitude. If you are always grateful for what you have, you don't usually stress yourself about what other people have or what you don't even have. The little you have, you are grateful for it. Thank you very much for the opportunity to share some insights. God bless you all.